What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Ken. But if this is the first time you've seen this channel, don't forget to subscribe. Welcome to Anatomy Practical Question Series, and we have a question here. So, you are asked to name the pointed opening again. Oh, so it's all about opening, okay? So this is the opening that you asked to name today. And what do you think is the next question gonna be? I guess you're gonna be asking about the structures. Name four. Name four structures that are going through the opening. Okay, let's go to the first question. What do you think this opening is? Me, I think it's a big opening. It's a huge opening. Wait, can you say that in Latin? Huge opening? Oh, that's foramen magnum. Okay, this is foramen magnum. And you see, you can name it from the shape and appearance. From appearance. So foramen magnum. Okay, so that's foramen magnum. But the biggest question is, what are the structures we are going through foramen magnum? So think about what's going on here. You have the brain and the spinal cord. They're connected, so they have to pass through the foramen magnum. So the very first structure you're going through the foramen magnum is going to be the brain tissue. So you can say the brain stem or spinal cord. I think whichever is correct, because if you're coming from the cranial cavity, it's going to have the brain. But if you're coming from the downside going to the cranial cavity, you are going to have the spinal cord. So brain tissue can be spinal cord or the brain stem. So next, think about artery, veins, and nerves. Think about nerves, arteries, and vein. So let me start with nerve. Which nerve do you think is going through the foramen magnum? That's gonna be cranial nerve number 11. So it's spinal accessory nerve, but it's a spinal part of the spinal accessory nerve. Remember, the spinal accessory nerve has got the two roots. It has got the cranial roots and the spinal roots. Now the spinal roots are going through the foramen magnum to join the cranial roots, and then this whole nerve, which is called the cranial nerve number 11 or spinal accessory nerve, is going to exit the cranial cavity through the jugular foramen. Yeah, so it does not exit through the foramen magnum. So in your exam, what you're going to answer is just to say the spinal roots of cranial nerve number 11 or the spinal accessory nerve. Only that. What about arteries? Think about arteries which are going through the foramen magnum. So we have arteries that on either side are passing through the it transfers foramina. What is the name of those arteries? Those going to be the vertebral arteries. So vertebral arteries are passing, and think about the nerves. There are veins. We have the plexus of veins. The plexus of veins, and these are the structures which are going through the foramen magnum: the brain tissue, spinal accessory nerve, the vertebral arteries, and the venous plexus. Most of the time we'll be asked to name 3, maybe. Okay, see you to the next question.